What is the lighting giving, y'all? What is it giving? Because I just purchased this. Well, I didn't just purchase it. Apparently, I purchased this light back in, I think, March or April. Forgot about it. Completely forgot about it. It's a ring light, by the way. And then I get a notice from my rental office, and they're like, oh, there's a package that's been sitting here for you. So I go get the package, and I have no idea what's in the package. And it's also addressed to my sister because, of course, I use her Prime account. So I'm like, girl, you have this package here. I don't know what it's doing at my place, but you need to come get it. Long story short, she comes to get the package, opens up the package, and it's a ring light. Took me forever to set it up, so you guys are going to let me know in the comments what this ring light is giving. But where have I been for the past few weeks? I was on vacation in Grenada. I did post a short, and I posted some content on TikTok. I spent, I think, maybe 10 or 11 days in Grenada, basking in the sun, relaxing, living local life. Didn't do anything too exciting. I tell people all the time, when I go to Grenada, I'm not on vacation. I'm going home. So all the vacation things that people do, like lounge, drink pina coladas at the poolside, things like that, I do none of that. I be up and down, living my best local Grenadian life. There's an article that was published by Bloomberg, and I heard about it online, like via TikTok. I heard some nurses talking about it. The article is titled "The Miseducation of America's Nurse Practitioners." I'm going to have to do a separate video because I have to comb through the article again and make some notes. So that way when I do decide to give commentary on it, I need to have the actual layout so I'm not all over the place, because I respect you guys too much to be all over the place. Let's see, what else has been going on? I am scheduled, well, I'm not scheduled yet, but I did receive my authorization to test for my nurse practitioner boards. I just yesterday finally purchased a review course. I purchased it with Sarah Michelle. That is the one I'm hearing everybody rant and rave about. So let me tell you something, Miss Sarah Michelle girl, okay? I paid my good money. I think it was approximately, I think I paid $351. Or was it $315? Something like that. It's a self-paced course that I'm going to use the remainder of August to study for, and hopefully schedule my test date for sometime in September, because I need to get this over with. I need to put this degree to use because I'm tired. Tired of picking up shifts at the hospital. Tired, okay? And while I say this, let me just say that on the video that I did talking about the population being sicker than they were 10 years ago, somebody tried to come for me in the comments. Like, she was in the comments basically chastising me. Let me see if I can pull it up. Chastising me for verbalizing how myself, along with most nurses, feel at the bedside currently taking care of these patients who have double the comorbidities, who are way sicker than what they were 10, 15 years ago. The fact that patients are living longer and they're coming in with more than just one thing going on. She was like, oh, how I'm complaining, and I signed up to take care of the patients and meet their needs, and now I'm complaining. If I don't want to do the job, I need to leave the field. Then she tried to challenge me, telling me that med-surg units do not have ventilator patients. And I'm like, okay, now you got me messed up, because my first question to her should have been, do you even work at the bedside? Do you work at the bedside? How are you going to tell me? I work in a hospital. I work on med-surg currently. I take care of vented patients on a med-surg unit, which is an acute care unit, not a long-term LTAC, long-term, what's the A for? Long-term acute. Hold up, what does LTAC stand for? LTAC, I know it's long-term. I think it's acute care facility. LTAC, sorry guys, I'm holding you up trying to. Long-term acute care, yes, I was right. So she's telling me in the comments that there are no vents on a med-surg unit. So my question to her was, I suppose you worked at every single hospital in the United States, because how you gonna tell me? How you gonna tell me? So then I responded to her, and I kind of feel a little bit disappointed in myself, because I shouldn't be calling people names, but I referred to her as Bird Brain, and I kept calling her Bird Brain in the comment section, like in my response to her, because how dare you be so loud, strong, and all the way wrong? Why would I get online and talk about ventilators being on a med-surg unit when so many people in the world can come and say, Kendra, no, you're not telling the truth. Med-surg do not get vents. Yes, they are med-surg units that take care of ventilator patients. Now I had to break it down for her, and this is where things can get technical. And this is where I said to her, well, I should have said to her, do you still work at the bedside? And of course, in one of her responses, she was like, oh, I work at a level 1 trauma center. Girl, nobody cares. Because a lot of y'all sometimes act as if working at a level 1 trauma center make you high and mighty. The one thing I will say is that nurses that work in rural settings in smaller hospitals will run circles around you and your level 1 trauma center. Okay? I've worked in 2 level 1 trauma centers. You don't hear me boasting about that. And currently right now, the hospital that I work in, it's a level 2 trauma center. Like, being a level 1 trauma center does not make you any better as a nurse, all right? Sometimes you're just thinking about the name and the reputation that the hospital comes with. And I live here in Baltimore, so we have 2 of the biggest hospital systems. Well, actually, one of them is one of the biggest hospital systems globally. You guys know who I'm talking about, Mr. JH himself. But anyway, she was like saying that in the comments about, oh, I worked at level 1 and I've never seen ventilators on med-surg units. Well, that's where you've worked, sweetheart. Sorry, y'all, something popped up on the screen and I was like, you know what, Sony? Count your days, because I will be investing in a new camera soon and it's probably going to be another brand. So count your days. So what I responded to her in the comments was ventilator patients. They are patients who are chronically on a ventilator, meaning that this is how they're going to live out the rest of their lives. They're going to be on a ventilator. The ventilator does the breathing for them. In some cases, some patients might take a break off the ventilator and go on trach collar. They're able to have their tracheostomy capped so that way they can eat. It's a variation of different circumstances. But for the most part, there are a lot of patients who will live the rest of their life on a ventilator. We have patients who are quadriplegic, either from some really traumatic fall, car accident, or it could be a gunshot wound. We have patients who have such severe respiratory distress or had severe respiratory distress that they've required a tracheostomy and now they're on a ventilator for the remainder of their life. Those patients are usually taken care of at nursing homes because family members cannot always take the patient home on a ventilator and care for them. When a patient is on a ventilator, they're required to have 24-hour care, hands-on care, because typically if you're on a ventilator, most of the time you're confined to the bed. There are cases where we have ventilator patients though who can get up that are somewhat independent with minimal assist connected to the ventilator. They can get up, sit on the side of the bed, go on the bedside commode and do things independently like that. But for the most part, patients are confined to the bed and they require someone to care for them consistently, meaning that you have to like change them, reposition them, turn them, just a bunch of hands-on care. So it's not manageable at home. Most of those patients are in a nursing home. So she's telling me that ventilator patients, that I don't work on med-surg, I work in a long-term care facility. And I'm like, no, I don't work in long-term care, I work in an actual hospital. And the point that I made to her was that these patients that are in the hospital on a ventilator, when they become ill in the nursing home, when they spike the temperature, or when they start having really low blood pressure, when they're hypotensive, or if they have extremely high blood pressure, they become extremely hypertensive. Or let's just say the patient now is not producing urine. Where do those patients get sent, ma'am? They get sent to the hospital because the nursing home is not equipped to handle acute issues. Chronic issues, yes. Lifetime issues with this patient laying in the bed, they might have like a bed sore. They might need to be straight catheterized every now and then. That's when you take a catheter and go into the bladder and drain their urine. They can handle those things at the nursing home. But once the patient becomes acutely ill and gets sent to the emergency room, there are a lot of hospitals that have ventilator beds on a med-surg unit. Now, the reason why the patient might be on a med-surg unit is because they're not sick enough to get admitted to an ICU. So critical care is not necessary for every patient that comes in on a ventilator. That's what I had to explain to her. If we have a patient that is on a chronic vent and they come in and they're critically ill based on their lab work, presentation, history and physical, whatever the scans are showing. Yes, there are times that chronically vented patients might require ICU admission, and then the ICU attendant will say, yes, we're accepting this patient to the ICU because they meet the criteria of being considered critically ill. But let's just say the patient come in, they have a UTI, they need to get antibiotic therapy via an IV, but there's nothing else really going on with the patient. Sometimes even that can be handled in the long-term care facility itself, but sometimes they have to come out because the UTI, the lab work, the other symptoms are not manageable within the nursing home. So they send them to the hospital and they get put on an acute care unit, which is a med-surg unit. So that is what I had to explain to her. I also had to explain to her that just because the patient is on a ventilator does not mean the patient is intubated. Now, if the patient is intubated, meaning that the airway is being secured with an ET tube, which is an endotracheal tube that's inserted by an advanced provider, be it a medical doctor, it could be a CRNA, a nurse anesthetist. It could also be a respiratory therapist, because in some hospitals, respiratory therapists can intubate patients. Now, if the patient is intubated and placed on a ventilator, usually it's a temporary intubation. And yes, those patients are usually critically ill. They've either declined really quickly in the emergency room, or they've declined in the field where 911 was called to and an intubation was necessary. So some, I don't know the difference. I think EMTs, or what's the other one? EMTs, and there's another name, EMS. A lot of those healthcare professionals are trained to intubate. So oftentimes, if we get a patient coming into the hospital, admitted to the ICU, when we get their history and physical as to why they're in the hospital, it would tell us whether or not the patient was intubated in the field, meaning like in their home, out in the open, wherever they were found down, they were intubated in the field. Now, if the patient is intubated with an ET tube, then yes, that patient belongs in the ICU. That is where they are managed. I worked in the ICU for, let's say, 9 years, and it's only been about a year since I really stopped going to ICU because I needed a break, okay? The burnout is real, and now med-surg is burning the heck out of me, so I might be going back to ICU. But in any event, I had to break down for her the different variations as to what kind of ventilator patient might be on a med-surg unit versus in an ICU. And you see, that's the thing. A lot of times in nursing, we have a lot of these nurses, because she came on and she was like, yeah, I've been a nurse for 25 years. Okay, whoop-de-doo. Whoop-de-doo, ma'am. You say that to say what? But do you still work at the bedside? Do you still work at the bedside? So when I pointed out to her the different variations or the different levels of a patient being on a ventilator, she gonna come back talking about, oh, she could send me articles and this. Miss, I don't need no articles. Miss, I don't need no articles. I work this, okay? I work this. I've been in the ICU for a number of years, different ICUs. During COVID, I've worked ICUs my entire COVID contract, okay? Proning, repositioning, paralyzing patients. How are you telling me? I'm speaking from experience. And for you to be wrong and strong and tell me that, oh, there's no patients, I probably work in a long-term care. Miss, I've never worked in a nursing home. I don't think I have the strength to work in a nursing home, because nursing home nurses are super strong to be caring for all of those patients, supervising the medicine aide, the LPN, doing supervisory paperwork, adhering to regulations. Nursing homes are heavily regulated. The nurses that work there, kudos to you guys, because I don't think I can do it. I forgot to mention too, I actually have a vlog on Grenada that I did that I've been trying to upload for the past week, and something funky was happening either with the storage on my computer or even with this editing software that I use. I use Final Cut Pro, and I was about to tell them count y'all days as well. Count y'all days, because why can't I export this video? And I don't even understand why I have a MacBook Air, and I think I had that computer now for 5 years. That's the one thing with Apple computers. They only last about 7 years. So I know it's on its last 2 years, if I'm correct, if I've only had it for 5 years. But it was giving me such problems to export the file. I don't even know if the file still exists. I might have to edit an entire vlog all over again of Grenada. I didn't do too much. I didn't vlog every day in Grenada, so when you guys see the vlog, I tried to make it as cohesive as possible and try to follow along. That was a lot of editing, so I hope it's not gone. I don't know what's going on. Other than that, let's see. My full-time job at the Eating Disorder Center is going well. However, I will admit that I am getting a bit bored because it's a bit redundant. Like, most of the patients come in with the same exact diagnoses. The one thing that's keeping me there, though, is I honestly do love the patients. I really, really adore my patients. But y'all, I'm getting bored. And when I start getting bored, I start getting worried because then I feel like I'm not learning. Or I feel like maybe this is not, maybe I'm like outgrowing this space and it's time for me to move. I'll be honest, I said it before in a previous clip. I am kind of tempted to go back into an ICU. I don't know, I've been having, as I was saying before the camera rudely interrupted me, the battery died. But what was I saying? Yeah, I've been feeling the itch to go back into the ICU, and I've considered applying for like some local ICU positions at local hospitals. But every time I think about the orientation process and having to like meet new people, get used to the unit culture, deal with, you know how it is. Some of you guys know how it is when you have to like go someplace new, meet new people, get accustomed to a new way of doing things. Like I don't know if I want to go through that. Like I don't know if I want to go through that. So that's the reason. Okay, I'm back. I was in the midst of speaking and the camera went dead. I honestly feel like my camera do not want me to be great and do not want me to pump out content. And I also feel like my computer is hating on me big time as well. I just went to Best Buy because I did step out and the guy was telling me some ways to troubleshoot my external hard drive. So that way I can upload more stuff onto it and create more space on my computer. But anyway, that's something I'll try in a little bit. So yeah, back to what I was saying about getting the itch to be back in the ICU. I'm kind of getting the itch, but I really just don't want to deal with having to learn new people in that environment. Like deal with orientation, deal with all these modules that have to be done. By the way, I have a bunch of modules that I need to do for my PRN job that I'm struggling to get through. Like, I don't know, it's just a lot. Now that I'm older and now that I've been in nursing for 14 years, the littlest things, like the simplest things, like going through orientation, having a preceptor, having somebody who could possibly want to like micromanage, and the thought of being micromanaged terrifies me, or have someone nitpicking or telling me, oh, this is the only way to do something, when in fact there's more than one way to skin a cat in nursing, especially if you're doing it, especially if it's a general task and there's no unit specific or no institution specific policy, but they just want you to do it their way when there's a simpler way or there's another technique to get to it. Like, I just really don't want to deal with that. So as much as I'm getting the itch to be back in the unit, I'm like, I should apply, but then I'd be like, you know what? You're not up for that. What I really need to focus on is getting my nurse practitioner boards over with. Hopefully I will pass on the first try. Anyway guys, I am going to catch up with you all in another video. I will be talking about that article that I mentioned earlier that Bloomberg published about nurse practitioners. So you guys have a good evening. See y'all later.